Good evening, Patricia. How are you?
Good.
This is Dr. Sinagra. I'm here with my patient, Patricia Eberstein. Take a deep breath, just relax. Patricia, were you compensated for this in any means?
No.
No, this is an honest to goodness testimonial.
Right.
Okay. We like to start out these testimonials, and the purpose that we like to do this for is we know there's people out there that click on our website that are in your shoes, and they have to make a decision about, hey, does this sound legitimate? Does this sound like something I might want to do? When you first came in to see me, the first thing you told me is you had a thyroid problem and you were on Synthroid, and you've been that way for about 15 years, correct?
Exactly.
Right. You said you also had developed type 2 diabetes, and you were on a drug called metformin, and your blood sugar was still very high.
Right.
You also had some neuropathy. I believe it was in your leg, correct?
Correct.
Yeah. And just overall general fatigue and not feeling good.
Right.
How'd you find out about us?
Well, I was searching online for to try to get some relief from the neuropathy in my leg,
Yeah.
and I came across your website.
Very good.
And I listened to some of the testimonies, and then I think you also gave some sort of a conference. And
Yeah, initial free consultation.
Right.
Yeah, that brings a lot of people in. So we also we don't like people to feel that they have to they'll be forced to pay to come talk to
Right.
us. We don't think that that's appropriate. So when you first came in, I told you what?
You told me that if I followed the protocol that you gave us, you would not only treat the symptoms, you would find out what was causing all my initial problems.
And I told you that you would start to do better.
Exactly.
Okay. What did you think? Did you think I was nuts?
No, I did not think you
Okay.
were nuts.
Were you skeptical?
In the beginning, but after I finished speaking with you, I really saw that you had a passion for what you do, and I trusted you.
Thank you. When you initially came in, I told you that there were two parts of our program. The initial part, and probably the most powerful part, is the upper cervical chiropractic. I'm going to pass you the model of the two bones. You remember these? Whoops. There we go. There we go.
Yes, I do.
When a patient comes in and they're dealing with this, our whole premise of what we do is if we can restore your body function, if I can make Patricia's body function properly, it's going to regain the ability to heal.
Okay.
And this is where medicine misses out in a lot. All illness is due to a manifestation of improper body function. Your body has to malfunction first. Once that happens, you develop symptoms, illness, and disease. When you came in, I said, our job is going to be to restore function, and there's a structural component to this. Your brainstem sits in between your first and second vertebra, and I told you when we remove that pressure from a misalignment up there, which we call subluxation, your body's going to immediately start to function. How did you handle the adjustments, and what did you feel right away?
Well, I felt, more relief to my back. Didn't bother me as much. I'm able to walk a little better. I mean, each time I've been coming, I see results all the time.
In general, when you first started, we told you we're going to look at you structurally. The second thing we said, we're going to look at your blood work, and we're going to look at you metabolically.
Right.
And when we went through your blood work, we picked up a couple of things. Number one, that you were an autoimmune patient, and that you had something called Hashimoto's thyroiditis, which means that your real culprit wasn't your thyroid, it was your immune system.
Right.
And that if we followed a certain diet we put you on, we were going to work at number one, balancing your blood sugar, getting your blood sugar down, helping to heal your adrenal glands, restoring gut function, and making your nervous system calm down. Now, I told you that was going to take us months.
Right.
By no means are you there yet, and you are what I like to consider a newbie. And in this testimonial, I don't want everybody at the end of the program to say, I want people to know that you've been here for about 4 weeks.
Yes.
Okay. In that 4-week period of upper cervical chiropractic care, following our diet and taking the supplements that were based on your blood, based on things that we found that were deficient in your blood, how would you, or what improvements have you seen?
I definitely have more energy.
Yeah.
Definitely have more energy. I sleep better. I'm able to, get a full night's sleep without any kind of pain to my leg from the neuropathy.
How is the neuropathy doing?
Much better. I must say, much better. I was walking with the cane, and I'm walking, now.
And you've only been here 4 weeks.
I've only been here 4 weeks.
How about
But I like the program that you have, and to me, I find it easy to follow.
Well, yes,
As long as you're committed to it.
when you find something that works and you start to see results, that also motivates you too,
Yes, absolutely.
So your energy got better, your sleep patterns improved.
Yes.
Okay. Right off the bat, when your energy starts to restore, that means that we're getting your adrenals back online. We're calming down the attack on your thyroid. And when you're starting to sleep better, it means your adrenals are also coming back online properly. That's huge.
Yeah, it's very
Now,
huge.
when you had neuropathy in your leg, what did they tell you medically?
They really didn't tell me anything. They just said it was part of the sugar, and they just kept increasing my metformin.
Yeah.
It
And
wasn't
lo and
helping.
behold, when you get to the root cause of problems, like I said when we started this testimonial, if you get the body functioning properly on all metabolic levels, you remove pressure at the brainstem level with upper cervical chiropractic, patients start to heal. What else has happened? You told me something the other day that was pretty amazing.
Told you that my toenails have had fungus underneath them, and they're all clearing up. It's amazing.
Okay,
I'm
so
floored.
now I know it's not comfortable sometimes to talk about that, but you had a toenail fungus under all your toenails on both feet.
Exactly.
Okay, and what's happening now in a matter of 4 weeks?
They're clear.
Now I can honestly be, and this is the reason I'm chuckling is. I didn't give you a supplement for toenail fungus. I didn't give you an adjustment for toenail fungus. Our diet's not geared for toenail fungus.
No.
Everything that we're doing is designed to make your body start to function properly. And lo and behold, what happens? Things just start to get better.
Exactly.
Pat, it's only been 4 weeks. I know you have a long way to go. Last but not leastly, you didn't come here for weight loss, did you?
No, I did not come here for weight
How much
loss.
weight have you lost?
14 and a half pounds.
Yeah, not bad.
No.
That's really great. And really, again, our diet's not a weight loss diet. Our diet, we're getting you healthy. And by eating the proper foods, and by balancing blood sugar, and restoring proper gut function, and restoring sleep, and restoring thyroid function, your body starts to normalize. I am so happy that you came down. Thank you so much.
Thank you.
You're really embarking. We've got a few more months to go to get you perfect, but I think you're going to do great. Thank you, Patricia.
Thank you.
Okay.